Life is good here in the Lowcountry, and one medical provider is working very hard to make sure that it stays that way. St. Joseph's Candler has been providing advanced medical care to citizens of the Lowcountry for decades. Known for their highly skilled medical personnel, their commitment to breakthrough treatments and state-of-the-art technology, St. Joseph's Candler offers a wide variety of programs and services to treat illness and promote wellness to all of the citizens of all of the communities it serves. Today, we're taking an inside look of one of the many ways that St. Joseph's Candler is improving the health and well-being of the region. This is Living Smart in the Lowcountry. Thanks for joining us. Today, we're taking a closer look at just one of the many medical services offered by St. Joseph's Candler here in the Lowcountry. We're in Belfair Town Center at St. Joseph's Candler's Imaging Services, where we're going to discuss some of the incredible state-of-the-art medical technology offered right here in Bluffton. How these tools assist physicians in better identifying medical concerns, and most importantly, how that improved technology can lead to improved patient outcomes. Let's get started. Hello, we are joined now by Dr. Daniel O'Meara, Dr. Jordan Dixon, both of who are radiologists here at St. Joseph's Candler Imaging Center. A lot to talk to you about today. Thanks so much for joining us.
Thank you for having us.
So let's talk about x-rays for starters. I think people are generally aware of x-rays, x-ray technology. Many people have had an x-ray themselves, but nowadays imaging technology has really advanced, and it's exciting to chat a little bit about this. Let's talk about how it has so radically changed over the years.
Yeah, as you say, X-rays in the early days of imaging were the tool that we had to make basic diagnoses like a broken bone or pneumonia. And X-rays are still commonly used as the first type of imaging to diagnose and screen for more obvious diseases because they're readily available and very easy and quick to perform at most imaging sites. Unfortunately, the two-dimensional images that we get with X-rays are relatively limited in the amount of information that they can give us about what's going on inside of our bodies. And so that's why CT and MRI, which provide very detailed 3D images of our internal organs, have become powerful and important tools in medical imaging. And CT and MRI have both advanced greatly over the years, both in terms of image quality and patient comfort. While the early scanners were relatively slow and cramped from the patient's perspective, the newer machines provide quick and comfortable experiences for our patients.
So, that's really interesting to hear how, the evolution of all this technology. Let's unpack this just a little bit more and talk about the differences, because there are so many tools available today. So it sounds like X-ray is still kind of in the mix. We still need it for certain functions, but we have now ultrasounds, 3D mammography, CT scans, and MRIs, as you were discussing. Can you give us a basic difference from a physician's point of view of when you might use these different tools and why they are important individually?
So as Dr. O'Meara mentioned, often X-rays, which can be from extremities to breast imaging, are the first line of imaging often used, and particularly in breast imaging, which is my field of expertise. Mammography remains the gold standard for detecting breast cancer, so that is often our first line of imaging. However, we do often supplement that initial X-ray imaging utilizing ultrasound or MRIs, particularly if there's a continued concern or complaint, or if a patient is at a high risk for something, such as utilizing breast MRI in patients who are at high risk for breast cancer based upon family or personal risk factors. Also, the additional technologies, CT or MRI, are great at looking at soft tissue, like our internal organs, or finer details at our joints.
So lots of different reasons to use all these different technologies. One that I want to spend just a minute or two on here before we head to break is MRI. So this, I didn't even realize what the acronym was for. It was magnetic resonance imaging, something we don't think about as patients sometimes. But you are the only folks in the area here at St. Joseph's Candler to do open MRI. I think that is huge. Let's talk about that and why that's so important to some patients.
Yeah, I agree. The traditional MRI scanners require patients to have their images taken while their body's inside of a relatively narrow tube. And that can be an uncomfortable situation for some patients, particularly those with claustrophobia or children who are being imaged that feel anxious when they can't see or hear a parent. And so open MRI is a newer technology we have to improve patient comfort. Instead of having the patient positioned inside that narrow tube, the patient goes into a larger, more rectangular space where there's a lot more light and a greater ability to see outside of the scanner. And you certainly feel a lot less cramped being imaged inside of an open MRI compared to the traditional closed system.
I can only imagine how impactful that is for somebody who feels claustrophobic or maybe gets anxiety leading into an MRI, to be able to have an experience that is so much better and more open. Hence the name. Well, thank you so much for joining us, Dr. Jordan Dixon. We appreciate you being here. Dr. O'Mara, you're going to stick with us after the break, as I hope you do too. We'll be right back. Welcome back in. Today we are talking to Dr. Daniel O'Mara, joining us here once again. He is a radiologist here at St. Joseph's Candler's Imaging Services here in Bluffton. Got a lot to talk about. I'm so glad you came back for us here.
Thanks for having me again.
Well, let's talk a little bit about some of the many services offered here. One that you're particularly involved in, and one that we're going to discuss right now in this segment, is called cardiac scoring. So tell us exactly what that is and why is that important?
Yeah. Cardiac calcium scoring is a helpful screening test for patients who have risk factors for coronary artery disease. And that's a process that causes stenoses, or narrowings, of the vessels that supply blood to our heart. As coronary artery disease progresses, it can restrict the blood flow to the heart and ultimately cause a heart attack. And so the goal of calcium scoring is to quantify the amount of plaque which causes those narrowings in the coronary arteries. And we do that by performing a quick CT scan of the heart. And that shows us the calcified plaque in the coronary arteries. And basically, the more plaque that we see, the higher the patient's risk is for having a coronary event like a heart attack.
Wow, okay. So let's talk a little bit about the patient aspect of this. I'm sure our viewers are wondering if there is somebody that has a high cardiac calcium score, is there something that they can do to lower it and lower their risk then for a heart attack?
Yeah, there are a lot of contributors to coronary artery disease, and that includes factors that we can control, like smoking and diets that are high in saturated fat and salt, and other factors that we can't control, like advanced age and genetics. And a careful review of these factors with one's physician can result in a plan to lower the risk of coronary artery disease. And typical lifestyle modifications include changes in diet and aerobic exercise. Though patients with very high cardiac calcium scores may need additional testing by a cardiologist to determine if the narrowings in their arteries have gotten so severe that they require medication or even a stent to open up those vessels and improve the blood flow to the heart.
Wow, a lot of factors here. Let's talk a little bit more about the provider side of things. So you as a radiologist, you must work closely with other types of specialty physicians, and that's really an interdisciplinary approach that seems to be important. Talk to us a little bit more about that and why it's so important.
Yeah, it's, as radiologists at St. Joseph's Candler, we feel very lucky to be able to work with the fantastic group of cardiologists and cardiothoracic surgeons and lots of other physicians in the region. And we're very grateful that they entrust the care of their patient to us. And in return, we strive to provide the best possible service, and that includes providing detailed and data-driven and timely interpretations of patient scans to these physicians so that they can make the best possible decisions for their patients and keep them healthy. We also maintain very open lines of communication with our referring physicians. So in the event that there's imaging finding that requires urgent attention, we will communicate directly with that patient's physician so that they can get taken care of very quickly.
Wow, a lot goes into this here, and one of the things I think that is so exciting about really talking to the folks here at St. Joseph's Candler is just the technology that you all have, and it has advanced so much over the years in the way that you're able to take care of your patients. If you can give us just a little, snapshot of what might be on the horizon in terms of imaging.
Yeah, as you say, radiology is constantly evolving and improving. In the early days, that typically meant improvements in the technology to be able to peer deeper inside the body and improve image quality, all in an effort to improve our ability to make a diagnosis. And certainly those advancements continue. More recently, improvements have been made in patient comfort in medical imaging. For example, the time that it takes to do certain CT scans and MRIs is decreased. The size of the scanner have increased, so it's more comfortable for patients to have their images taken. And as I look into the future, I'm excited to see a variety of powerful computer programs that are on the horizon that promise to help radiologists make accurate diagnoses and help them monitor and characterize disease.
Wow, well, we look forward to hearing more about that as things unfold, but this has been great. It's really given us a lot of insight into patient care and what goes on here at St. Joseph's Candler Imaging Center. Dr. O'Mara, thank you so much. We appreciate you, and we appreciate you. We've got more here at St. Joseph's Candler after the break, and we hope you'll stick with us. Welcome back in. We are here at St. Joseph's Candler. We're at the Imaging Center, and if you're just tuning in, boy, we have already learned a lot. Some of that, of course, from Dr. Jordan Dixon. We've asked her to return. We've got some more to discuss. Thanks for coming back with us.
Thank you for having me.
So you're a diagnostic radiologist specialist here at St. Joseph's Candler, and I want to talk a little bit more about diagnosing breast cancer. How have you seen that change over the years?
So the advancements in breast imaging are vast, and they are amazing. They're rapidly changing. We have gone from 2D mammography, which is still in use, but now we prefer, if possible, to get 3D mammography, also known as tomosynthesis. It provides us additional detail where we can diagnose breast cancers much smaller and earlier, which obviously affords people the greater possibilities of treatment and even cure. In addition to mammography, the use of whole breast ultrasound is now recommended for patients, particularly patients with dense breasts, which is lots of women. So this is going to help find breast cancers which are smaller, earlier stage, and therefore they'll have more treatment options available to them. Also, most recently, we have breast MRI, which we use in supplement of mammograms, which remain the gold standard for breast cancer detection. So we use this breast MRI, often staggered with mammography. So every 6 months, women of high risk or with dense breast tissue are getting some sort of breast imaging. So this, again, is going to find smaller, earlier cancers that are more treatable.
Wow, amazing. And how impactful for the patients to be able to begin treatment sooner, have better outcomes. One thing that is fascinating, and we didn't have to think about years ago, is COVID vaccines and how this plays a role into all of this that we're discussing here today, really, but specifically breast cancer. So women have began their series of COVID vaccines, and some of them have even experienced symptoms of breast cancer. Can you explain that?
Yes, so the COVID vaccine in particular, but all vaccines in general do have an immune response, and that's what we would like them to do because they're activating our body's natural immune responses so that we can generate a response if we were to encounter that disease in the future. So part of that disease and vaccination response is to get lymph nodes that are big, and those are most notably in the armpit. Patients are getting their vaccine in their arm, and so they'll get enlarged lymph nodes in that armpit, in that axilla, and those often go down over time, but that also can be a sign of breast cancer. So if a patient is feeling those enlarged lymph nodes, then they should go to their doctor and make sure that that truly is from the vaccine and not a sign of breast cancer. We've also noticed patients getting some thickened skin on their breast in that side that they got the vaccine, which should improve with time, but that also can be a sign of breast cancer as well. And so that should just be evaluated by their doctor, and their doctor may decide to do some breast imaging or to watch and do serial physical exams to make sure that that's improving over time.
Yeah, so I guess the lesson is really just if you feel like there is any concern, it's best to get it checked out.
Exactly.
Let's talk a little bit more about screening. And, mammography, it seems like, is still the best tool, but there's more to talk about here because there's been improvements. 3D mammogram, for example, has, really been a game changer. It seems like you have whole breast ultrasound. Let's talk about that because that must change your job incredibly.
It does indeed. So we always begin with screening mammography. That remains the gold standard for breast imaging. So that's how we start, and that's the only way to determine if a patient has dense breast tissue. That is not determined on physical exam or simply by patient's age. This is only determined by the radiologist, such as myself, on a mammogram. And so if a patient does have dense breast tissue, or if they're high risk for breast cancer based on their personal risk factors or their family history, then they may also qualify for additional supplemental screening with whole breast ultrasound. And so the mammograms, if a patient has dense breast tissue, the cancer shows up as white, and their dense breast tissue also shows up as white, and so there can be a camouflaging effect when women have dense breast tissue. So the addition of the supplemental ultrasound is crucial because the cancers will show up as black against white breast tissue, so it will help those cancers to stick out, and so that is how we find those smaller, earlier cancers.
That's amazing to me, and I'm supposed to go to break, but I really want to ask you if you can quickly talk to us about maybe some of the future technology that you see.
So in addition to mammography and ultrasound, the breast MRI really is on the cutting edge of breast imaging, and that really is helping us to find completely undetectable cancers not seen with mammograms or ultrasounds, and helping people to find these early cancers.
Technology, it's amazing. You all are great. This is St. Joseph's Candler, Dr. Jordan Dixon. We'll be right back. Welcome back in. We're here at St. Joseph's Candler. We're at the Imaging Center, and we're at Belfair Town Village, a very convenient location. We've talked a lot about the advancement in technology, and we're going to talk a little bit about what all this means, everything we've been discussing today to the patients. We've got Cheryl Rawlings here, who is the manager here at this location, and it's so nice of you to have us here. Thanks for having us.
Thanks for coming.
And Fred Spavafora has joined us. He's a patient for many years. We're going to hear a little bit from you about that experience. Cheryl, I'm going to start with you. We've spoken in previous discussions about personalized care, and I want to just discuss how you ensure that your patients get that level of care.
St. Joseph Candler has some of the most highly skilled healthcare professionals. When the patients walk through the door until the patients leave us, we want to make sure that they are informed, they're comfortable, and they know they're in a safe environment.
And Fred, you really can speak to that personally. Let's talk about that from the patient side. We've heard about all this, the advancements in the personalized care and what that can mean to a patient. We have you here. What does that mean to you?
It means a lot. Since I've been coming here 4 or 5 years, everybody is so professional and courteous, and especially Erin, who mostly does my ultrasounds. She's been very nice. It makes you feel like you're at home.
I've spoken to a few patients over my time here talking to folks, and a lot of similar discussions about just the level of care that they get in every aspect at St. Joseph's Candler. Cheryl, I want to talk a little bit more about imaging as a diagnostic tool, and there are a lot of things that go into this as far as integration and communication with the referring physician, with the radiologist, with the patients, really a lot of moving parts. So how does all this come to play? How do you keep this going? How do you make sure that that communication is so seamless?
Well, imaging is really at the center of the healthcare chain. Communication is key. Our radiologists dictate reports that go to the referring physicians. The referring physicians can then review the reports in private with their patient, or the patient can also access our patient portal for their healthcare information.
A really important point here, and part of the dynamic is that communication and how you all are managing that. Another important point before we head out, Fred, I've been talking about the location just a little bit. We're at Belfair Town Village, right here in Bluffton. We have all of this amazing technology and staff and level of care here. You wouldn't necessarily think that. You don't have to travel to Savannah or Charleston. That's got to be big for you as a patient.
Yeah, we live like 15 minutes from here, and Dr. Goldner is next door. He's with St. Joseph Candler. Dr. Mullins is one of my doctors. He's with St. Joseph and Candler, and Dr. Hunt. He's my other doctor, and he's here too. And it's very convenient. You just come here. You don't have to go, like you said, you don't have to travel any place. So it makes it very convenient for us.
It really does, and it's a big deal to be able to get that level of care without the travel. Thank you both for sharing a little bit about what you do here, how you make it all happen, and your experience as a patient. We so appreciate it.
Thank you.
And thank you.
Appreciate you.
Thank you so much. We appreciate our viewers. Thank you so much for watching. Thank you for joining us today. We hope you found this both educational and beneficial. For more information on this program or any of the services provided by St. Joseph's Candler, please visit our website at sjchs.org. We'll see you next time on St. Joseph's Candler's Living Smart in the Lowcountry.